Ladies and gentlemen, thank you very much for joining us this edition of Elite Project. I'm your host, Rex Bear, and we have Dr. Len Saputo with us again. He's a regular here on the Elite Project and just one of my favorite people in the world. He has a really great approach towards helping others with health, real balanced, and he's been in the medical industry for years. So, Len, it's an honor to speak with you again. How the heck are you?
Oh, fine, Rex, and it's great to be back on the show. It's really fun to talk with you about a lot of the stuff that we do because it's controversial material that people need to know about. We need to change healthcare, and you're one of the prime movers of it. Thank you.
Hey, thank you. I mean, the honor is all mine just to have you on the show. So I would recommend our listeners go to drsaputo.com. And if you have a chance to live in California, how cool is that? Because you've got one of the greatest doctors ever to live in that state. So just really easy to get access. Now, we talked before a little bit about the infrared healing modalities and technologies, essentially, that you've had a lot of flack with the FDA and other organizations to try and suppress it. So I was hoping we could spend some time diving into that with not only technology, but the applications and what you've had to go through so far.
Yeah, you bet. I might just start with the beginning of how I got into it. It was about 16 years ago. I met a guy named Maurice Bales. And he had written an article in one of the throwaway magazines for medicine that I was just kind of leafing through. And what he said in there kind of threw me for a loop. And I thought, well, this is just BS. I'm not going to pay attention to it. And as I was about to throw it into my circular file, I noticed that he was a local fellow that was just in Lafayette, which is 5 minutes from where I live, which is shocking for a national magazine. So I called him up and I said, why do you print stuff like that? And he says, you're just like all the other doctors around. He says, I'm not a doctor, I'm an electrical engineer, but I've been working with this technology of using infrared light for quite a few years, and we've done a lot of research on it, and I can't get anybody to really take note of it and bring the technology forward. It's been very difficult. So he said, I'll tell you what, why don't you bring by a couple of patients? We'll treat them with the infrared light, any patients you want that have pain. So I picked one guy who had a failed back syndrome, which means he had severe back pain, post-surgical, and was on lots of drugs, and another person who had MS. And this man with MS was almost bedridden most of the time. Now, these both came to his office with me, and when we got there, he showed the technology to me. He showed it to the two patients. He took the man with MS, who was coming in all kind of hunched over and barely able to navigate, and the amazing thing was in about 15 minutes, this man was more upright. His pain was dramatically reduced. And the follow-up to that is within about a month, that man went back to work full-time. Now, he still died from his MS, but the quality of life he had was fantastic. And the man with the failed back got a little better, but not a lot. So he said, would you like to learn more about it? And I said, well, I'm impressed with what you did. Yes, I would. So he said, well, let's get together then, and you bring some patients over. And so we agreed that after work on Mondays and Wednesdays and Fridays, I'd bring 2 or 3 patients to his office, and we'd treat them. And we did that for 3 months. And at the end of 3 months, after seeing all these people with a wide range of conditions getting better, he says, what do you think now, Mr. Smart Guy? Do you think we should bring this technology forward? And that was the start of a beautiful relationship. And since that time, we treated thousands of patients and brought the technology forward in a clinical way in our area in a big way. And now people know about infrared light therapy, which I do as part of my practice. So we brought the technology forward. We have new equipment. He's an amazing electrical engineer. And I think he's the leader of the field in bringing forward technology that is really the best technology. We've improved the power of it about 80 times since what we started with. And we now have machines that have many watts to them. So some of them are 5 or 10 or 15 watts. And I'm really impressed with what this technology does. Now, Mr. Bales also has had some patents on this equipment, and we tested it by doing our own clinical research. We did a study on 120 patients at the VA hospital that we presented to the FDA before we did the study to say, would this be a study you would agree to give a patent to and a license to practice and the RVS code so doctors could bill for it? And they said, yes, the study looks good. So we did the study. We spent $100,000 of our own money because we couldn't get any grants from anybody. And the study came out positive and met the specifications they talked about. Well, they turned it down. And on the side, they told us, this is probably never going to pass because of the kinds of problems we get into with the pharmaceutical industry. Can you imagine how much would cost the pharmaceutical industry if this technology was brought forward in a big way? And this was several years ago when this happened. And since that time, I'll have to say there have been advances, but I still haven't seen any billing codes, which is your bottom line here, that allow practitioners to bill for the services. And as an example of that, I have a friend who practices orthopedic surgery. And his idea was to try this technology because I was telling so much about it. And he brought it into his office. And I said, well, keep the machine for a month. We'll see what it does. And then let's talk about whether or not you want to start this up in your own practice. So a month later, I talked to him. He says, well, it doesn't work. And I said, what do you mean it doesn't work? I said, what did you do? He said, well, what I did is I went ahead and I gave the machine to my nurse and told her what to do. But I'm not so sure he really knew what to do. And we talked about it some more after that. And what the bottom line turned out to be is he says, look, Len, the real problem here, I can't bill for it. You're billing $60 for a treatment for a 15-minute treatment. I can bill $300 for a 15-minute treatment if I do my surgical procedures. I can't afford to bring this technology forward. So we've got a problem here, Rex. We've got a great technology that we've done clinical research on. And by the way, we did a second study at the University of California in San Francisco that's now pending. I haven't seen the results of it yet, that looked at how to treat peripheral neuropathies where people are having terrible pain in their feet or numbness in their feet and their balance isn't right from chemotherapy. And there are millions of Americans suffering from that, as well as the diabetics who are suffering from neuropathy that we treated in our first study. So we're at a place where I'm so frustrated because we've got a major breakthrough in medicine here. That's a paradigm shift. It's not the typical biochemistry and the drugs, surgeries that we're so used to using in medicine. What this is a shift in how we are bringing energy medicine forward so that we can begin to use that in the form of light of different kinds of wavelengths and frequencies that do magical things to help people with a wide range of conditions. So I look at the FDA as really having conflicts of interest, but what's new? I mean, you know they have conflicts of interest. You report that in your show all the time.
Of course. I mean, that's how they survive, is suppressing everybody else and keeping their, little sweet poisons that give you one opportunity of hope and then create 10 other problems, essentially, is what it comes down to. I mean, it's just the whole system, it seems like, is pretty corrupt. But let's talk about these light technologies, because that is fascinating. Let's say that somebody goes in to see you, and give us some ideas on what these light treatments can help with. I guess you have to be careful on what you say too, right? Or else the
No, I can have an opinion. That's allowed. What I can't do is I can't say that we can bill for it for the procedures that we do. So when I bill a patient, I have to disclose that it's not going to be reimbursed by any insurance company, certainly not by Medicare. And then I can say what I want as long as it's my opinion. So I'm not going to get in trouble for that. But it does a wide range of things. I think the biggest things that it treats really are the neuropathies. The diabetics with neuropathy, people who are alcoholics with neuropathy, the chemotherapy-induced neuropathies, and then a wide range of sports injuries, cervical discs and lumbar discs, people with sciatica, carpal tunnel syndromes, tennis elbows. I've had a few people, and this is really amazing, who were literally blind in one eye. And I can remember the first person I treated was a diabetic who had had a stroke. And she couldn't see anything out of that eye except really fuzzy stuff. And I had a picture of a ship with ropes and with masts, and she couldn't differentiate anything. I shined the light in her eye for about 30 seconds and told her to open her eye at that time after it was done. And she could see the ship and the ropes and all the stuff that went with it. Her vision came back. I treated her 5 or 6 times, and she said, I don't want you to do it anymore. And I said, well, why? She says, because my vision is good now, and this hasn't been tested well enough to know what the long-term effects are. I said, you've got a good point there. We stopped. I haven't talked to her now in a number of years. And I've had several other patients who have had that problem too. And now there's some good research showing that you can use it for different kinds of eye conditions to reduce inflammation. They did some studies that were fantastic on rats. This is terrible. What they did is they fed them wood alcohol. So they gave them methanol. And within a couple of days, they all go blind. But if you treat them after they've been poisoned with infrared light, they don't go blind anymore. So what we're looking at is a very interesting technology that does a lot to make tissues stronger, to make them metabolically stronger, to increase the production of ATP, which is the energy currency of the cell. Gasoline runs a car, ATP runs your body. And if you can put more ATP and bump it up by 50%, which we now know you can, tissues that have been injured, that don't have good circulation, all of a sudden start to function. And it happens in the rats who have lost their vision, or would be losing their vision, and now they don't. So I can't think of a painful condition that this can't work in. We're even using it in people who have unusual pain conditions, people who have what's called reflex sympathetic dystrophy, which is a long story, but basically people who have unbelievable pain. You can hardly even touch their feet. And if you use this technology in combination with real-time scanning with an infrared camera, because see, excuse me, the body emits infrared light all the time. We all emit that. And the patterns on the surface of the skin can be measured with the machine that's an infrared camera, just like the infrared cameras now that we use, that NASA uses to see things at night, or that hunters will use to see elephants or whatever they want to see at nighttime. And when you do this and you scan people in real time as you're treating, you have a before picture, which is on half of the screen. Then you have a picture in real time that shows you, as you're using light, what happens as you're treating. And because I've been doing this a long time and I know the patterns, I know exactly what's happening. And usually in about 5 or 10 minutes, I can take somebody who has a neuropathy or sciatica or other kinds of severe pain and eliminate their pain. And this is in 10 minutes. And I'm not saying this cures the conditions in 10 minutes, although for some neuropathies it does. I'd say the bulk of people who have diabetes with neuropathy, or who have chemotherapy-induced neuropathy, or wide range of other neuropathies, 2 or 3 treatments of 10 minutes. And you've got somebody who's a very happy camper because the pain is gone. Nearly always the pain is gone. The numbness is improved. And when the numbness improves, you can navigate with more security because you know where your feet are. And the same thing can happen in people who have back pain with sciatica, and they come in limping. 10 minutes later, they're walking out and they don't have pain anymore. And if you do that over a period of time and use that in conjunction with other therapies, things like chiropractic and acupuncture and body work and imagery and a wide range of other kinds of services, you get these people to go from being invalids, they're getting out of their wheelchairs, and they're able to walk and do some more of their normal activities. So there's a lot going on there, Rex.
What is imagery?
Well, guided imagery, a lot of the time what I'll do with people, particularly on Fridays when I teach, is I'll bring people into the office and we'll put them on a massage table. And there may be 4 or 5 of us there that are working. And I'll talk as we're in the presence of the other people who will all be doing their technologies. So say an acupuncturist is there. They may be putting needles in. We may use pulse electromagnetic field, which is another therapy that's similar to the light therapy. Somebody else may be doing Reiki therapy. And I'll be doing a little bit of cranial sacral work and at the same time doing an imagery of what I want that person to feel. And they go into this deep trance-like state. And within 30 minutes, they come out and it's just like magic. I mean, it's amazing what this integrative approach can do. See, I'm not saying that infrared light therapy is the cure-all for everything, but I can say it is the most amazing thing that I've seen in 50 years of practice. And I think that we need to bring forth biophysics rather than biochemistry. I think the biophysics is what regulates the biochemistry. And we need to be looking at that rather than this primitive biochemical effect that we have. When you look at the complexity of the body and look at a biochemical pathway chart, there are thousands of biochemical reactions there. And when you change one reaction, you affect every other reaction that's there in some way. It's sort of like looking at a big spider web. You touch one part, it touches everything. And when you see that happen in biochemistry, you know that thousands of things are happening, not 1 or 2 things, but thousands of things are happening that you have no idea what you're doing. And that's why we have all these, what we call side effects, which aren't side effects at all from medications. These are the real deal. These are the effects of the medicine we don't like. So we try to minimize them by calling them side effects. That's just baloney. So it's not a surprise that what we're doing in biochemical medicine has got so many problems and why we have several 100,000 people dying every year because of the effects of the treatment that we do. I mean, you can even just look at the NSAIDs, the non-steroidal anti-inflammatory drugs, meaning things like Celebrex and Advil and Aleve and Motrin and 20 other ones that are out there. Those drugs are killing 30,000 people a year in the U.S. 30,000 people a year die from that, and they're expected to. And another 300,000 go to the hospital because of serious complications. I had one patient who's a friend of mine who was in Europe on a vacation. He got some back pain. He took Advil for 3 weeks, came back, was in renal failure. I thought we were going to have to put him on dialysis. Fortunately, he recovered from it. But these are powerful drugs. They cause GI bleeds, GI perforations. They cause kidney failure. They cause heart attacks. And they cause strokes. And we're using them like water thinking, geez, it's just an Advil. What's the problem? So that's what's happening.
I am so glad you brought that up because I have often heard many of those effects, not side effects, as you say, just effects, because there is a reaction to every action, obviously. And that's pretty frightening, though, to hear personal stories where you know somebody that was just on Advil for 3 weeks and then you thought they were going to have to go on dialysis. How frightening is that? I know people that take those types of medications like they're candy, you know, or like
Yep.
like they're popping just a breath mint or something like that. And I've always done my best to stay away from that stuff as much as possible, unless you absolutely have to take a Tylenol because your head's just pounding or something like that. I mean, I can certainly see in occasional circumstances that might help somebody. It's not going to cause brain damage and
Yeah, you never say never, and there's a place for everything. I mean, there's a place for drugs and surgeries and technologies. There's a place for complementary and alternative medicine. There's a place for light therapies, for magnet therapies, for Reiki, for imagery. And you need to know all those things. And the problem is we doctors, we already go to school for about 10 years before we get out. It'd take you another 10 years or 15 years to learn about, well, what's Chinese medicine? What's Ayurveda? What's energy medicine? Blah, blah, blah. I've done that on my own because I couldn't stand practicing just the way I was trained. Fact is, if I had to practice only that way, I'd go teach tennis or something. I certainly wouldn't practice medicine. It's way too dangerous. And we need to be open-minded to what are the other options out there? What other treatments are there? Are they okay? Do you know anything about them before you throw them out? It's sort of like we're talking about the role of spirit in health, in medicine, which we talked about last time we talked. And because science doesn't understand spirituality, they just throw it out and say, well, we don't know how to study it, so we're just not going to look at it. That's like a little baby who says, I'm going to take all my marbles and go home because I don't want to play with you anymore.
Right.
A good scientist looks at what they don't understand. And that's what we need to do.
The problem is like you said earlier, these ginormous conglomerates that own so much as far as different industries and businesses, the pharmaceutical companies, it's like they're a big mafia, and they're not going to let these.
What do you mean, like a big mafia?
Exactly. Well said. The pharmaceutical industrial complex seems to have so much clout and power with the lobbyists and the politicians, and just everybody that has a position of power oftentimes can succumb to these guys for whatever reason because of the powers that they have. And I can certainly understand in certain circumstances where people feel like they can't talk out because maybe they're threatened. And you hear there's just a huge list that's growing every single day of alternative doctors that are ending up suicided. It's very frightening.
Yeah.
And
I'm more afraid of that than I am the FDA or of the medical profession coming after me. I'm more afraid of that.
Yeah. Now, how many people do you have the opportunity to discuss stuff like this with on a regular basis? I mean, do you have shows that you do on your YouTube channel where you discuss stuff like this as well?
Yeah, we got a lot of stuff on YouTube. We've got a couple of million visits to our site over the last few years. And I've had radio shows myself. I've been doing radio for about 20 years. We stopped about 3 or 4 years ago because my wife, who was my partner and is a Screen Actors Guild actress, and a lot to do with why the show was successful, said, I'm tired of this. I don't want to do it anymore. So I said, well, I don't think I want to do it myself. So we stopped about 3 years ago. But I would be open to starting up a show myself if the circumstances were right again.
You know, Len, I certainly feel that would be a good thing for everybody except for the pharmaceutical companies because, you really do bring such a great approach. You know what you're talking about. You've gotten yourself into the trenches. You're doing this stuff. And I'd like to know more about that magnetic therapy that you were discussing a little bit about.
Yeah, it's called pulsed electromagnetic field therapy. And if anybody wants to look it up, it's called PEMF. And just Google that and all kinds of stuff will come up with it about it. You can go to my website at drsaputo.com and put that in and stuff will come up about it too. I've only been using that about a year. And what I found is it does some of the same things that light does, some of the same mechanisms, but done in a slightly different way. So for example, if I've got a patient who won't respond to the light therapy who has a diabetic neuropathy, what I'll do then is I'll bump up the dose of light that I give, and if that's enough, because there's a certain threshold you have to get to, and when you get to that threshold, all things start to happen that make things better. But if you can't, on those people, I'll try the pulsed electromagnetic field, and sometimes, voila, it works. And sometimes I'll use both at the same time. So it's a great adjunct, and you got to keep your mind open all the time for new things that are coming along. As soon as you get complacent in what you do, you stop growing, and you become confined by the boundaries of your knowledge. That's a pretty dangerous thing to happen. And that's unfortunately what happens to the medical profession. I'm not saying we don't do new research, but I've got to tell you, our research isn't very good. First of all, there are too many factors that we can't take account for that influence the outcome of every study. And that's a big deal if you can't look at all the factors that are involved there. Second, there are conflicts of interest that are huge because who funds them? Most of them are funded by people who have conflicts of interest, by the pharmaceutical industry that funds $92 billion a year of research. NIH, the National Institutes of Health, which is our government research organization, only funds $32 billion. So there's stuff going on there. Plus, we know from quantum physics that the observer of an experiment affects the outcome. Now, what do you have to say? You really can't do a study that you can trust. And it doesn't surprise me because they change from time to time. It reminds me of a study I did when I was a sophomore in medical school, when all the research about cholesterol was coming out. The Framingham study was out, and they were saying how cholesterol is causing problems with heart attacks and strokes. And our study came out the opposite. It said that if you had a higher cholesterol, your chance of having a heart attack or a stroke were lower. And we thought we'd done the study wrong. And now we're finding out that a lot of that is right. And it's not like cholesterol is a bad thing for you. It's a good thing. The problem is if your body's inflamed, then it does things to cholesterol that make it do things to your body that cause heart attacks and strokes. So this is a fascinating study for me.
Now, also, if you were to get into the acupuncture stuff, because everybody's heard of it, yet most people that have never experienced it would think automatically, I'm assuming, I guess I shouldn't assume, but me personally, I thought, wow, acupuncture, how does that work? I mean, you're affecting every part of the body by putting a needle in one specific location. Essentially, you can affect another part. So talk to us about that, if you would.
Yeah, sure. I mean, that surprised me too. And I thought, oh, how can it be? We must, I mean, we've done all the anatomy we can think of, and we must know that there aren't any acupuncture channels, blah, blah, blah. But it turns out it's not true. If you put an infrared light over the bladder meridian, over this spot right here, all the other areas on that channel will light up. So you know they're there. These studies have been done. And it confirms that there's an energetic system that has meridians that control the function of the organ systems. And we know that this has been around for thousands of years, and people get better with it. And we have boards who study it. Just because we don't understand all the details of it doesn't mean that it doesn't exist and it isn't right. It's sort of looking at the spiritual side of things. Just because we don't understand the role of spirit in healing, should we just throw it out? Or just because we don't know how the effects of biophysics works to manage the biochemistry of the body, we should throw it out? These are things that we have to pay attention to. And if we do, then we're going to understand more about what happens, or at least we're going to take advantage of the outcome studies. I think we're going to be learning more in research by doing outcome studies, which means you alter certain factors in a study. Maybe you're treating cancer and you're using 10 different things, so you're not going to know which one works. But if you use those 10 things and you study 100 patients with them and 100 patients without them, if you got a good effect when you get done, the outcome is a good thing. And if you can replicate that, you should continue to do it. And that's how I look at it. And that's how I look at all the new things that I don't understand. It was back just in November that I went to India. And I spent 3 weeks there in Panchakarma for myself because I'm 76 years old. And because I've been around a long time, I think it's time to detoxify. So I stayed there for 3 weeks, did all the protocols that they do there, and came out a healthier person. We have to keep an open mind. And these technologies, whether we understand them or not, particularly the ones that have been around for 8,000 years like Ayurveda has, is worth taking a look at.
Now, that's one thing that I've never even heard of until today. Would you tell our audience about that?
It's a very interesting way of looking at people, at healthcare. They're based on body types. They have heavy-set people, thinner people, and people that are more muscular. And then they have different qualities that they've assigned to that. And for thousands of years, they've done things like change your diet to meet your body type. They do a lot of work with massage and with oils that will help you to detoxify, because we live in a sea of toxins today. We've polluted our food, water, air, and soil, and we accumulate those toxins, and and a toxin is something that gets in your body that shouldn't be there because it's not part of your normal metabolism. And if it is there, it's going to interfere with it. So what you'd like to do is get it out. One of the things that Ayurveda does is that, and Panchakarma is what that's called, and that's why I went to the southern part of India for 3 weeks to do it.
That's incredible. I've actually got a friend that went to not only India, but some other places, I think, outside of India for like 3 months. And he did this real long detox. He's seriously into yoga. He's crazy eccentric and real nice guy, very far out there. And I appreciate him for that. I mean, that's what I like about people that are unique. But he came back a different person. And now he's like wanting to go out there again. And I'm like, hey, good for you, man. So it really changed his life going out there. Yeah.
Absolutely. I think that if you keep an open mind, you're going to learn new things. And my job is to go beyond the boundaries of what I was taught in my training, and to be open to new ways of looking at things and willing to examine some things that are actually contrary to what I learned in school. Because let's face it, since I went to school and graduated from medical school and residency, a lot of things have changed. And if I had just stuck in that one paradigm that I'd learned, I'd be doing the same thing we were doing 50 years ago, which is no good. It's actually the reason I started an organization called the Health Medicine Forum. I did that in 1994, and it's been around now for quite a few years. And I bet in that interval, I have moderated 350 events. Don't think you don't get a good education that way, because what happens is when you moderate an event where you have a chiropractor and an acupuncturist and an Ayurvedic practitioner and somebody who does body work and a psychologist and an internist or an orthopedist, and you're looking at one health problem, you're getting viewpoints of how they manage it, your mind starts to open. And some of the stuff that's done is totally different. I mean, you can look at somebody who does a certain kind of body work and compare that with what an orthopedist does. And they should be talking to each other in a much more serious and detailed way, because the body workers know things that the orthopedists have never hardly even heard of. And you have to look at, what is the orthopedist doing? They're fixing people that have such an advancement of the deterioration of a part of their body that they're replacing joints. Now, why does that happen? A lot of the time it's because of alignment. It might become because of an old injury or some kind of problem that somebody had when they were sick that altered the way that they walk or that they move. And you get repetitive stress injuries, particularly when your muscles are all contracted. But if you look at some of the bodywork styles or the physical therapy approaches to this, you really can do a lot to change the ongoing damage that's done to a joint. And that's something that should be integrated into the care of every patient who has any kind of joint pain. We shouldn't be waiting until we need knee replacements and shoulder replacements and hip replacements, because those are dangerous operations, even though most of us are led to believe that these are totally safe operations. I can tell you, I had a hip replacement twice on the right side, and I had last rites when I had after I had the first surgery, because I had gotten into so much trouble. I have a friend who just had a knee replaced about 6 months ago, and he still can't run. I had another friend who had a shoulder replacement. Lots of problems with that, even though when we get to a certain point, we have to do something. But the point I'm trying to make is, if we keep an open mind and we look at the possibilities of what can be done to prevent these things, not just catch them with early detection like we did with breast cancer, which is too bad. We should be preventing these things with all the modalities we can. So we should be looking at, in an open way, any kind of therapy that's possible that's brought forward by somebody, particularly if they have boards. And even if they don't have boards, we should be taking a look at what's possible to incorporate into the treatment of my patient. The good example I like to raise all the time is, look what our oncologists are doing for cancer patients. It's a travesty some of the time. And I'm not saying they don't save some lives. They do. You look at your leukemias and Hodgkin's and lymphomas. If I have one of those, I'm going to my oncologist and I'm going to get chemotherapy and whatever else they say, because they do save lives there. But you look at most of the solid tumors, and they're using chemotherapy. And at the end of 5 years, the number of people who have been benefited from that with life extension is 2 to 3%. Now, to me, that's criminal, and that shouldn't be done. So I made a video. I've made actually 2,600 audios and videos that are on my website and on YouTube that are free, that talk about things like that. And one of those videos is, what is wrong with oncologists today? What's the problem that they have? Why do I berate them? It's because I think every cancer patient deserves to have as many possibilities for treatment offered to them as possible. Why? Because this is a serious disease that kills a lot of people. And if there's somebody who can add something that's not toxic, particularly, like so many treatments that are possible today, every oncologist should know that. They should be required to have training in that. If I had cancer and my doctor didn't know about that, I wouldn't accept that person as a doctor. Because a lot of the time what they do, they get to a certain point and they say, okay, now you can go home and prepare to die because we haven't got anything else. Well, tell me, Mr. Oncologist, did you look into some of the things that are in Mexico? Did you look at some of the other alternative therapies that are being talked about these days on YouTube? There are a lot of approaches there that are possible. So I think we got to have an open mind. For myself, I have a section on my website about cancer on the homepage that if you click on, you can learn about ways to diagnose cancer, to prevent or to find it early. You can look at various different treatment strategies, and there are probably 15 or 20 different strategies there beyond the mainstream's approach. to give you some kind of idea of what's possible. And I think that's the obligation that every healthcare practitioner needs. And it's not just the doctors. I mean, the Ayurvedic doctors and the Chinese medicine doctors and the chiropractors and nutritionists and blah, blah, blah. They've got a responsibility as well. And so the very least we should be doing is working together as a group to look at people who are sick and do panels. It's not just going to the hospital and having different kinds of doctors evaluate you and tell you what to do. It's about having an open forum. We get together like a community. And we do that in my practice. We do what's called a healing circle, where we bring different practitioners together at the same table with the person, with the patient, not separate from them. This is where they participate. We spend 2 hours listening and caring to these people. We don't charge 1 cent for those things. They're always free. And the main reason for that is because we want people to know that we truly care about them and we've thought about it. And we're trying to look at all the possibilities that are out there. So that's how I look at it, Rex.
Yeah, that's fantastic. And I also had a friend that told me once about how he went to Mexico. I'm bringing up Mexico because you brought it up. Mm-hmm. And he had some skin cancer, and he said that the doctor got rid of it with hydrogen peroxide.
Well, that's possible.
Have you ever heard anything like that?
Yeah, I'd want to talk to that person 5 years later and see what happened. There are lots of ways to get rid of a skin cancer. You can use that. You can use curcumin. I mean, there are lots of ways to do that in different disciplines, and they're worth taking a look at. I think it depends on what it is. If I had a melanoma, I probably want to take it off because melanoma is such a bad disease. If I had something like a squamous cell cancer or basal cell cancer, I might be more inclined to try something that's a little different for a while because you can watch them for a while. So what it requires is a relationship between a person who's sick and a healer who's willing to listen and care and to go back to the internet and study what's possible, because no single healthcare practitioner knows everything. If there was one that knew 1% of what's out there, that would be a lot. So every time somebody comes into my office who's got a serious problem, I'm calling other doctors. I'm trying to find out what they did and why. I'm going to the internet to try and study their particular illness and see if there's anything new that's possible. I reach on my own experience to use technologies like the light therapy in people who have cancer, because now we've got some interesting new ways to treat cancer using light. One is we can relieve the pain. Most of the time, people have bone metastases, so their cancer from their breast or lung or wherever has gone to their bones. It's usually a pretty painful thing. And wipe that pain out most of the time just by shining a light for about 10 minutes over those areas or using the pulse electromagnetic fields. But it's still, that's just one part. We're also doing something called photodynamic. I say we, the field. I am not in my practice yet, but I'm looking into it. Are doing something called photodynamic therapy, where what you do is you inject a chemical that only goes to the tumor, either because it's got antibodies, it's an antibody that will attack the tumor, and then onto that is attached a chemical that will be activated if you shine infrared light on it. And infrared light goes deep into the tissues, and it goes 10 inches deep into tissues. So you can activate those chemicals that are bound to that tumor and kill the tumor. And it sounds like, well, that should cure cancer. Well, we haven't exactly found that that's the result. But if we perfect that, there's a possibility that could do it. And that's a very interesting application of infrared light therapy. So there's lots of stuff happening, Rex.
Yeah, that's amazing. And I've also seen a lot of stuff in the nanotech forums that show these little micro robots that essentially can piggyback off of the flu and other bacteria and viruses, and it essentially lodges them in these certain locations in the body, and then it starts to work. Have you ever seen anything like that under a microscope or insider source? Or
I haven't done research on it. I've read about it. People are using what are called bacteriophages sometimes now that will actually be like organisms that kill microbes. And by the way, blue light, real concentrated blue light, kills things like MRSA. So that's the methicillin-resistant staph. So we know that we've got antibacterial effects from light therapy that are on the verge of being studied. But there's research out there, a fair amount of it, that talks about this. But it's in its early stages, and unfortunately, for deeper structures, you still can't use blue light because it doesn't get in very deep. But there are people now using intravenous light therapy. Try that one on. There was a procedure called photooxidation that was done probably 75 years ago, before the antibiotic era came out. And there were some studies done on people who were in the hospital with ruptured appendixes and abscessed gallbladders and other kinds of inflammation, infection in the abdomen that was serious and life-threatening. These people were all going to die. Okay, and what they did is they put a tube in somebody's vein. They let blood come out through that tube, and as it did, it went through a coil of tubing onto which ultraviolet light was shined. That ultraviolet light treated about 200 cc's of blood, which was then injected back into the body, and that cured most of those people, even the ones that were in the ICU and really sick. And you'd think, well, why didn't we continue that technology? Well, when the antibiotics came out, this was a bigger deal. You could take a pill and get the same effect. And so it kind of died. Even though there was one paper that was published that I know of in a journal called Surgery, where they looked at 250 consecutive cases of people who were terribly sick with peritonitis, and the bulk of them got well within just a few treatments and went home and lived normal lives. Now, with infrared light, blue light, yellow light, red light, they all have different kinds of effects on the body. And there's now a group of people who are using it intravenously. So what they're doing is putting a catheter into a vein, just through a normal needle, like they use to draw blood, and then taking these fine little fiber optics and running it through that, and then pulsing light of different colors with different power. And it's possible that some of these people who have cancer or who have Lyme disease or blah, 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 okay, are going to be able to be treated that way. I was scheduled to go to Germany to learn about this with a doctor who has a lot of information that's published on the internet. And I talked to him, and then I talked to my friend Maurice Bales, and he said, Len, I think we can get a light that we can make ourselves. We don't have to go intravenously. You just shine, it'll go right through the vein and do everything that, it'll treat everything that's there. So we're working on that now and hoping that we can do something to change the way that we approach people who have severe infections and people who have cancer, because a lot of these people have circulating stem cells, like with breast cancer or lung cancer. And the cancer really comes from the bone marrow. It doesn't come from the tissue that it's in, which is a surprise to a lot of people. So there is a lot happening.
Yeah, that's incredible. And then do you do things also where if you incorporate Reiki, what is Reiki anyway?
Well, Reiki is an energy medicine, and it's proprietary. I don't like that part. And quite frankly, I think you can do the same thing without having certification from somebody. But the nice thing about Reiki is it's been studied as a tradition for a long time, and there is a system that works. I know my wife, Vicky, does Reiki, and I know it works because she's used it on me and my family, and we're going, what's this? She channels energy through her, and it comes out through her hands. And then she'll put it on an area that's inflamed, like you have back pain or a sore knee or whatever you have. And in 15, 20, 30 minutes, you get up and start to move around, and it's like, what'd you do? And just because you don't understand it doesn't mean you throw it out. Those are the ones that you really want to pay more attention to. So it's a way of transferring cosmic energy, call it what you want, through the body into somebody else's body for healing purposes.
And so I remember one time I tried an experiment where I was able to see if I could get my hands at a certain temperature by doing these imagination techniques, and it worked pretty well. And I did it with somebody else, and she noticed it also. I guess that probably is the same type of techniques. Somebody that would just be a master at Reiki would maybe. I think it's done in different ways. Biofeedback is a great example of that. We know that you can use you put a thermometer in somebody's hands, and you can, through your thinking, you can reroute blood flow to your hands rather than someplace else. And when blood comes into a tissue, it warms it because that's where the heat comes from. And that's a simple biochemical or biofeedback tool that we use. So that's right. All these things are interesting ways of looking at what's possible. And we can never get enough of that because there's plenty of disease that's going around, but there's not plenty of solutions. So we should, instead of fighting with each other, we should be getting together and seeing if we can work together and pool our resources and appreciate what other people do that we don't know about, even if it's contrary to the way we were trained. That's just simple common sense. Absolutely. And the golden rule is treat others the way you want to be treated.
Exactly. And so I'm interested in listening to my patients. I don't even like calling them patients. I'm interested in listening to my friends who come to see me. If I listen long enough, they'll tell me what's wrong with them. And if I listen even longer, they'll tell me what they need and what their treatment should be. It takes time. And if you'll take the time, you'll do it. But if you're more interested in just making money, then you'll make money.
Now speaking of making money, it's always good to have money. I mean, it definitely helps. And certainly if you do the right things with it, you can change the world. And also, I know that you've been working on possibly at least reaching out there a little bit towards this hospital, but it's not your typical hospital. It's feng shui. It's got people from all different types of healing modalities together. And how's that working out? Have you looked more into that, or?
Oh, I've been thinking about it for 30 years. And I had something that was moving in that direction. We had 5,000 square feet at one time and 15 different practitioners, including a Native American Indian chief. It was a great place to work. The problem is the economy was good, but as soon as it went south, these services aren't covered by insurance because the medical system has a monopoly on reimbursement. So you can't expect people to pay for something if they don't have money. And so that whole system went down. What I'm looking for, and I hope there's somebody out there with about $30 million who is, near the end of life and is wanting to do something that's good, but not quite knowing what to do, to talk to me about what my ideas are to build a facility like that. And then not worry about reimbursement, because if you had that kind of money, then you wouldn't just be treating rich people. You'd be treating anybody who can come there, because you could rely on an endowment to be able to pay your doctors and other practitioners who are there to be able to provide integrative services and see how much more you could do in that setting. And I think if that model worked, it would be one that maybe you could get people to look at, or maybe other people to make endowments for other people. And who knows, if we clean up our act in this society because we're so oriented to dollars and to materialism and to power, that we look at that as our holy grail rather than quite the reverse, which is what we can share and give and love. I mean, that's the real measure of success. So when you're done with your life, you better look at those qualities rather than the qualities that have to do with, I amassed a fortune and I'm as rich as Bill Gates. That's not a good thing in my mind for building community. So that's my dream.
Oh, certainly you could be at the cusp of reaching that. $30 million, as much money as that is, I look at the defense industry, and $30 million is probably spent every second. Literally. I mean, it just, who knows how many trillions of dollars are really spent in the defense industry. And I certainly, it's great to have a nice, powerful military. Yet, wouldn't it be nice if we had a healing system that was just as effective as the killing system that is in play? Could you imagine?
Yeah, well, I do imagine all the time. I dream about it. And I know that it's a possible thing. It certainly can be done. I got sort of an offer from a country in the Middle East to get involved with a facility there, and I decided I didn't think I wanted to do it for rich people in Arabia or wherever it was, so I let it go. But I think what I'd like to do is set something up out here and then pull the best doctors into it and be able to pay them from the endowment every year. So if I had 10 or 15 people who would be working with me that had regular hours and I could pay them, then who cares how they spend their time? And I'd like to be able to show those people how to spend their time so they could do this integrative system that would be done and really promote healing rather than just fixing a few symptoms.
That could take a whole spark. You do that one system, and then maybe somebody in Sedona, Arizona would pick it up, and then maybe somebody out.
Exactly.
Yeah, absolutely.
Exactly. Everything is built into the system the way it is. We look at medicine as the top dog. Medicine is not the top dog. I'm sorry. If you're talking about trying to cure symptoms, yeah, we do a pretty good job there, but because of the disparities in our healthcare system, we're ranked 37th in the world in the overall quality of healthcare by the World Health Organization. There's something wrong with that. We're not spending our dollars wisely. We spend $3 trillion a year on healthcare. That's obscene for what we get back. And then we're treating people, the poor people get Medi-Cal or Medicaid. I mean, what kind of service is that? Or they're getting Obamacare, which has got lots of holes in it. I'm afraid that's going to have to be expanded greatly to be what the original intent of Obamacare was, which was universal health care. But even then, you don't really want to be giving more of the same terrible health system to everybody. What you'd like to do is design a healthcare system that makes more sense. So that what we're doing is we're bringing an integrative approach to it. We're making it available to everybody, not just people who are have a lot of money, and trying to build community and see how much we can give and share. It's a contest to see how much can I give, not how much can I get. It's sort of like what love is all about. When you first get married, I hate to say it most of the time, it's all about you. It's all about me. It's all about what I get from this. You make me feel good. I love the sex and I love being around you, and it makes me feel like I'm whatever I feel like that's good. Well, mature love isn't about that. Mature love is, how can I make you happy? I want you to be happy, and I want to give you everything I can so that you will be happy. because that makes me happy. So it's about how much can I give, not how much can I get. And that's why we see so many divorces and so many people who are going through life and they're failing. Their epitaphs don't say anything good. It's a shame.
Wow. I think that what you said right there was just a real powerful statement, and I'm going to bring this up more often. Hey, everybody that has an opportunity to listen to this broadcast, how much can you give?
Yeah.
Not how much can you get?
Yeah, it's a contest. It's a contest if you want to look at it that way. It really isn't. It comes from an inspiration. It's not to prove I can do more than you do. It's because I want to do that. And why do I want to do that? Because it feels right. I'd rather see you happy. I just talked to a woman in Mexico yesterday by Skype who has advanced cancer. And I'd never met her before, but she sent information and I can see she's dying. And when it was over, I said, you know, I can't charge you for this. I don't want anything from you. I want you to find a way to make peace. And then I referred her to somebody who was close to where she lived, who I thought could provide the best integrative care for cancer, even though I didn't really give her the idea that there was a lot of hope for it. But that to me felt so good. And she was crying with happiness, tears of joy, that somebody listened to her and cared about her enough. They didn't charge a penny.
How cool is that, Len?
That's so cool. That's so cool.
That's priceless, is what it is.
Yeah, it is.
Well, this is just always a real pleasure to speak with you. I would recommend our listeners go to drsaputo.com. You will have access to an enormous library, different healing programs, assessments. All this is free. And if you have a chance to get a hold of Dr. Saputo, if you're in the area, if you can work with him, make sure to give him a call. His contact information is on drsaputo.com. So also, folks, I'd recommend you go to leakproject.com. If you become a contributing member, you'll have access to exclusive content. Also, youtube.com/clandestine Time Lord is always free for the podcast. Len, is there anything you'd like to share with us before we close out tonight?
No, I just want to thank you for being there and for helping me to get information out, because we're both working together. You know, we're part of a team. You know, we're in a community of people who want to do the right thing and just share all the things that we think are important. So it's nice to be able to have a voice and to get to people so they can understand that. So thanks so much for all you do, and invite me back. I'd like to be on anytime you'd like.
Absolutely. We'll definitely have you back on again. And ladies and gentlemen, be the change you want to see. This is Rex Bear. Good night. Ladies and gentlemen, thank you very much for joining us this edition of Leak Project. I'm your host, Rex Bear, and we have Dr. Len Saputo with us again. He's a regular here on the Leak Project and just one of my favorite people in the world. He has a really great approach towards helping others with health, real balanced, and he's been in the medical industry for years. So, Len, it's an honor to speak with you again. How the heck are you?
Oh, fine, Rex, and it's great to be back on the show. It's really fun to talk with you about a lot of the stuff that we do, because it's controversial material that people need to know about. We need to change healthcare, and you're one of the prime movers of it. Thank you.
Hey, thank you. I mean, the honor is all mine to have you on the show. So I would recommend our listeners go to drsaputo.com. And if you have a chance to live in California, how cool is that? Because you've got one of the greatest doctors ever to live in that state. So just really easy to get access. Now, we talked before a little bit about the infrared healing modalities and technologies, essentially, that you've had a lot of flack with the FDA and other organizations to try and suppress it. So I was hoping we could spend some time diving into that with not only technology, but the applications and what you've had to go through so far.
Yeah, you bet. I might just start with the beginning of how I got into it. It was about 16 years ago. I met a guy named Maurice Bales, and he had written an article in one of the throwaway magazines for medicine that I was just kind of leafing through. And what he said in there kind of threw me for a loop, and I thought, well, this is just BS. I'm not going to pay attention to it. And as I was about to throw it into my circular file, I noticed that he was a local fellow that was just in Lafayette, which is 5 minutes from where I live, which is shocking for a national magazine. So I called him up and I said, why do you print stuff like that? And he says, you know, you're just like all the other doctors around. He says, I'm not a doctor, I'm an electrical engineer, but I've been working with this technology of using infrared light for quite a few years, and we've done a lot of research on it, and I can't get anybody to really take note of it and bring the technology forward. It's been very difficult. So he said, I'll tell you what, why don't you bring by a couple of patients? We'll treat them with the infrared light, any patients you want that have pain. So I picked one guy who had a failed back syndrome, which means he had severe back pain, post-surgical, and was on lots of drugs, and another person who had MS. And this man with MS was almost bedridden most of the time. Now, these both came to his office with me. And when we got there, he showed the technology to me. He showed it to the two patients. He took the man with MS who was coming in all kind of hunched over and barely able to navigate. And the amazing thing was, in about 15 minutes, this man was more upright. His pain was dramatically reduced. And the follow-up to that is within about a month, that man went back to work full time. Now, he still died from his MS, but the quality of life he had was fantastic. And the man with the failed back got a little better, but not a lot. So he said, would you like to learn more about it? And I said, well, I'm impressed with what you did. Yes, I would. So he said, well, let's get together then, and you bring some patients over. And so we agreed that after work on Mondays and Wednesdays and Fridays, I'd bring 2 or 3 patients to his office, and we'd treat them. And we did that for 3 months. And at the end of 3 months, after seeing all these people with a wide range of conditions getting better, he says, what do you think now, Mr. Smart Guy? Do you think we should bring this technology forward? And that was the start of a beautiful relationship. And since that time, we treated thousands of patients and brought the technology forward in a clinical way in our area in a big way. And now people know about infrared light therapy, which I do as part of my practice. So we brought the technology forward. We have new equipment. He's an amazing electrical engineer. And I think he's the leader of the field in bringing forward technology that is really the best technology. We've improved the power of it about 80 times since what we started with. And we now have machines that have many watts to them. So some of them are 5 or 10 or 15 watts. And I'm really impressed with what this technology does. Now, Mr. Bales also has had some patents on this equipment, and we tested it by doing our own clinical research. We did a study on 120 patients at the VA hospital that we presented to the FDA before we did the study to say, would this be a study you would agree to give a patent to and a license to practice and the RVS code so doctors could bill for it? And they said, yes, the study looks good. So we did the study. We spent $100,000 of our own money because we couldn't get any grants from anybody. And the study came out positive and met the specifications they talked about. Well, they turned it down. And on the side, they told us this is probably never going to pass because of the kinds of problems we get into with the pharmaceutical industry. Can you imagine how much would cost the pharmaceutical industry if this technology was brought forward in a big way? And this was several years ago when this happened. And since that time, I'll have to say there have been advances, but I still haven't seen any billing codes, which is your bottom line here, that allow practitioners to bill for the services. And as an example of that, I have a friend who practices orthopedic surgery, and his idea was to try this technology because I was telling so much about it. And he brought it into his office. And I said, well, keep the machine for a month. We'll see what it does. And then let's talk about whether or not you want to start this up in your own practice. So a month later, I talked to him. He says, well, it doesn't work. And I said, what do you mean it doesn't work? I said, what did you do? He said, well, what I did is I went ahead and I gave the machine to my nurse and told her what to do. But I'm not so sure he really knew what to do. And we talked about it some more after that. And what the bottom line turned out to be is he says, look, Len, the real problem here, I can't bill for it. You're billing $60 for a treatment, for a 15-minute treatment. I can bill $300 for a 15-minute treatment if I do my surgical procedures. I can't afford to bring this technology forward. So we've got a problem here, Rex. We've got a great technology that we've done clinical research on. And by the way, we did a second study at the University of California in San Francisco that's now pending. I haven't seen the results of it yet, that looked at how to treat peripheral neuropathies where people are having terrible pain in their feet or numbness in their feet and their balance isn't right from chemotherapy. And there are millions of Americans suffering from that, as well as the diabetics who are suffering from neuropathy that we treated in our first study. So we're at a place where I'm so frustrated because we've got a major breakthrough in medicine here. That's a paradigm shift. It's not the typical biochemistry and the drugs, surgeries that we're so used to using in medicine. What this is a shift in how we are bringing energy medicine forward so that we can begin to use that in the form of light of different kinds of wavelengths and frequencies that do magical things to help people with a wide range of conditions. So I look at the FDA as really having conflicts of interest, but what's new? I mean, you know they have conflicts of interest. You report that in your show all the time.
Of course. I mean, that's how they survive, is suppressing everybody else and keeping their, little sweet poisons that give you one opportunity of hope